Hello again everyone and welcome back. As I said before, my name is Susan and this is the owner of Prime Health Concept, and as a lot of you may already know, she's also my eldest daughter. Okay, so in this particular video we want to answer the main question that people are asking us. What is included in our price? So we're going to do a general talking about this because of course Prime Health Concept does a lot of different procedures. So we're going to wrap it all and talk about it in general, what's included in our packages. Okay, so Rianne, so from the minute someone will contact you, what happens?
So someone contacts us and we first obviously need to check if they're suitable for the procedure they want. And we get in contact with the surgeon and the hospital. We check all of their medical history, and if they are suitable, we go back to our patient and say that they're suitable, and then we look at flights and dates that they can come out.
Can they actually get to meet the surgeon before they actually come out?
Yeah, of course they can. If they want, we could organize a conference call. And with a video call they could speak with the surgeon, ask whatever they want, and even like with plastic surgery they even don't need to send us photographs. They can have the video call and the surgeon can just tell them right there if they're suitable or not for the procedure they want.
Okay Rianne, so now they've booked with you, their flights are booked, etc, etc, and they're flying out and they've arrived at Izmir airport. What happens?
When they actually leave the plane door, someone there will be there to welcome them, and they take them through the fast track, so they're not waiting in queues for passport control or anything. They help them out with their luggage, they get their suitcase and everything, and they actually carry it for them. And if they want to get anything from duty free, they will help them out with that all, and then they will bring them to the international arrivals, and we will take them from there to our lounge, and when the car is ready waiting for them outside the airport door, we will take them to the car.
So then they are taken where?
They're taken to the hospital, but some of our patients when they arrive they don't want to have the surgery right after the day they arrive, so they want to relax sometimes 1 or 2 days, and then in that case, then they go to the hotel. But if they're going to have surgery the next day, they usually go to the hospital.
They arrive at the hospital.
Yeah.
What happens?
When they arrive at the hospital, one of our carers will be there to welcome them. They will help them out with everything. They will tell them whatever to do, so they don't need to panic or worry about anything or what's happening now and everything. All the paperwork will be explained by our carer. They will go through it all with them. They can have time to read it all too. They don't need to sign it all at that minute. And usually the urine and blood test is done at that night, and the rest of the tests will be done the next morning.
When you say our carers, what do you mean by that?
We have carers in the hospital 24/7. They are in the room on the same floor. We have a room in each floor in the hospital, and they will be in that room 24/7. They come and check on our patients regularly anyway. They help them out with anything they need, even if they just want to sit and have a chat. They're there for them for emotional support, for translation, and when they go to surgery, they go into the theatre, hold their hand till they go to sleep, and then when they get woken up, the patients, our carer will be there, so it will be the first face they see will be one of our carers when they're woken up after surgery.
Okay, and all of that is included in the package that we're talking about. Whatever the medical procedure they have, that's finished, and they leave the hospital. What happens then?
Then someone in the hotel, one of our carers again, will welcome them in the hotel, and they will be there 24/7 for them again. If they need any translation help wise, or if they even want to go out for a meal, they could ask them and they will organize it for them. If they want to go out for shopping, they can ask our carer again and they will organize it for them. And they're there for emotional support again, or whatever they need.
When they go back, do they have papers that they can take with them to inform their doctors? What
Yes,
happens? Because is that all in Turkish? How does that go?
It's all in English for them. They will have a fit to fly paperwork that basically says they fit to fly back home because they had surgery. And all of the paperwork, all of their pre-op test papers will be in that file that they have, and what happened in the surgery, what procedures been done and everything, so they can take that back home to their GP.
Now you leave the hotel, you come to the airport because you're going to fly home. What happens from there?
Again, someone would welcome them from the transfer car, take them through check-in, passport control, or if they want to go to duty free and buy anything, all of that is done fast track, so they're not waiting in any queues.
Okay, and onto the plane then?
Yeah, they will take them right to the plane.
Okay, so now they're back home and they have a query, they have a problem, they're nervous about something. What happens then?
We have an excellent aftercare team. Actually, you're the leader of the aftercare team.
Thank you.
And whatever they need, emotional support, or they have a question that needs to be asked to the surgeon, they can ask the team and they will ask the surgeon and get back to them. Or if they have any concern about their eating or their scar or anything, we're there for them to, answer all of their questions.
So what happens about regularly when you have any sort of medical procedure? You normally have checkups, 1 week, 2 weeks, 1 month, 2 months after. What happens with regards to all of that? They're back home, but we're in Turkey, so what happens?
I mean, it depends on the procedure that they had. Like with gastric sleeve, we need bloods done and sent to us regularly, and that's the 1st month, 3rd month, the 6th, 12th and the 24th. And they go to their GP, get the bloods done, and they just send the results to us, and we send them to our surgeon, and our surgeon will tell them how they're getting on, or if they need to take any extra vitamins or anything.
Okay, so what if someone wants to actually see their surgeon again once they're back home? Can they have meetings with the surgeon?
Yeah, of course they can. We can organize a video call and they can chat and they can ask whatever they want.
And is that all included in the package,
yes,
in the
is.
price?
Yes.
Okay, thank you.
You're welcome.